Montreal is the epicenter of the pandemic. The number of cases has progressed significantly in the past 24 hours. We're at 2,642 cases, 17 deaths, 149 hospitalization, and 39 people in intensive care. That represents exactly 480 new cases in the past 24 hours. It's 148 healthcare workers and over 20 outbreaks in our CHSLDs and elderly homes for the elderly. You understand that we are in the ascending curve of the pandemic. We said it. Geographically speaking, certain sectors are more affected than others. However, when we look at community transmission, all of our boroughs, or almost all of them, are knowing important growth. We're not going to confine any one borough or neighborhood that's not efficient. For now, we're not going to be closing down the bridges or putting restriction on them. That is not what is going to transmit the community transmission right now.
We ask everybody to stay in their neighborhood. Go to the grocery store in your neighborhood. Go to the pharmacy in your neighborhood. It is very important to contain as much as possible the spread of the virus. And speaking of taking a bit of air, I've said it yesterday that we do not want to close down all the parks. For a lot of Montrealers, this is their only way to enjoy a little bit of green, a little bit of space. A lot of people don't have a backyard or even a balcony. So it is important for us to keep them open, but everybody needs to follow the rules. And the 2 meters is very, very important. If you see that a place seems to be crowded, don't go there.
So the outside activities, we talked about it, jogging, walking, biking. We wish to keep allowing these. We believe that the risk, that the virus is not going to jump out at us if we respect the 2-meter distance. No, we are in the epidemic curve that we were expecting. So no, we have not lost control. I would tell you that in the past few days, we haven't doubled the number of new cases per day. However, we're still in the ascending curve. And when we look at our estimates, to look at where we get to the peak, and 10 days after that, it will be the peak of hospitalizations, because it often takes a week to 10 days after the beginning of symptoms for people to have symptoms that are more serious. So we realize that we really are in the ascending curve, and that means that right now, the virus is probably at its full potential, circulating throughout the community. That's what this means. So we're not losing control. I think the measures that we have taken are the correct ones. And as I said, when we are in presence of community transmission, to put a sanitary cordon in these strategies for isolating populations, there are different measures of distancing that we can do, and we do it gradually. And the sanitary cordon is really to isolate a region where there's low transmission, or very, very low, no transmission, to a region where there is. In Montreal, and even in the greater Montreal area, if we have extra control measures, we're going to have to include Laval, the South Shore, the South area of La Naudière, and the confinement. The strategy that the government took is to take it peripherically to protect those regions that are further away, and that's the right strategy. Right now, having a sanitary cordon, well, we can reduce moving around and staying in a neighborhood, but confining Notre-Dame-de-Grâce away from a Huntsic or another neighborhood, that is just not an efficient strategy in a context where there is transmission that is very well installed anyway. Are there mainly people who were contaminating in a CHSLD or homes for the elderly? I'd have to look. I don't have the numbers with me right now, but we have not found out the place of contamination. Would have to make a specific extraction for that. For the screening tests. Yesterday, Dr. Drouin, you mentioned that there was a problem with the labs, and that is what was slowing down, and we had to expect an important increase in the number of cases. Yes, that's what we're seeing as well. In the course of the past few days, but I think that by tomorrow probably the labs had what they call a backlog. So in Quebec, I think we had over 13,000 or 15,000 which had not been fully analyzed, and we were told 13 to 15,000 tests, yes, that had not yet been analyzed. So we were told that in the course of the next few days, so probably it should be over by tomorrow, that all of that, they were going to succeed coming back to a state of normalcy. But I think it's around 7,000 lab tests per day is the capacity, and the idea of emitting priorities is really, of course, to protect the healthcare workers, the essential workers, and controlling our outbreaks in the different residential facilities where we know that there are people who might have a higher risk of dying, might need more intensive care. So that's where we're going to put our energies with the capacity that we have. But with the residual capacity, the directors of public health of different regions will have the discretionary choice of determining which group might be screened first as a priority. And we will do it as well to try to control outbreaks in riskier areas or groups in Montreal. So that is what we are working on right now. And as soon as we have a much greater screening capacity, for sure we will broaden the scope to more people in the Montreal area. So that screening capacity, is it linked to a problem with equipment or staff? Because it was mentioned quite a bit in a few social networks. I think it's more the equipment right now. Okay, so a lack of reagents? Yes, that's the problem. Well, from what I know, I mean, it's not my file personally, but I've been told that it is an issue. A question.
TV, we know one of the sources from the outbreak of cases at the Verdun Hospital was a doctor who was asymptomatic, making rounds on several floors. Is there anything else that can be done as procedure or policy to help stop this from happening, especially when it's a doctor that doesn't show symptoms? Should we be more regularly testing all health professionals for COVID-19?
As you've seen, testing health professional is one of the priority that is it's one of the group that we are giving a priority. I don't have all the details on what happened at Verdun Hospital because, as you know, we have outbreaks in a couple of hospitals right now, but of course, we have to make sure that every essential worker, and especially those working in the healthcare units, if you have any kind of symptoms, just don't go to work. That's the first thing. And of course, we're testing more and more people, but we're not testing like asymptomatic person, and the test is not reliable for asymptomatic person right now, the test that we have in Quebec.
Thank you. Last question from